Ovarian Cancer Canada welcomes you to this session of our telephone and online education series for women with ovarian cancer and their caregivers. Today's session, What Do I Do Now? Making Decisions About Your Care, will be given by Liezl, who is an advanced practice nurse, a clinical investigator, and the manager of the Gynecologic Oncology Day Unit at the Ottawa Hospital. For those of you who registered, you have received today the PowerPoint presentation that you can use to follow the teleconference. I am Iris Pizon, Program Manager of Ovarian Cancer Canada. OCC endeavors to provide women with ovarian cancer and their caregivers the information that they need. We hope that you will find this interactive session interesting and that you will address your questions to Liezl. The line we are on is an open line, so you can interact with the speaker. You can ask your questions, but please mute your telephone if you are only listening. The previous telephone education sessions are available on YouTube at www.youtube.com/Ovarian Cancer Canada. Videos have been posted in 10-minute segments and ordered in parts to make it easy for you to listen and later return to where you left off. We hope that you can help us with your feedback. An evaluation form will be sent to attendees via email or regular mail. And now, please welcome Liezl.
Thank you, Iris.
No problem.
So, like I said earlier, I want to make this as interactive as possible, so please feel free to ask any questions as we go along, and I will be asking questions as well to try to make this as meaningful as possible and related to each person's kind of own situation. So one of the things, so as far as the objectives for the talk, and I guess I should have added a slide to that, and that might have been useful for people to try and figure out joining in. So, or about four things that I want to cover. One is to explore what are the various types of decisions that women with ovarian cancer are faced with. To look at a framework in patient decision-making and see how that might be useful. To learn about what are decision aids as a tool to help make decisions. And then for us to kind of work through one of decision aids in a decision, so any kind of decision. So having said that, the talk today is really not about any one decision in particular, and I would actually even expand it beyond decisions in ovarian cancer. This tool can be used for any types of decisions, whether it's related to a medical decision that you have to face, or whether it's something personal in your life that you're struggling with. And certainly I've used it for some of those things. So we've already... Regina?
Yes?
Do you have the slides in front of you?
Yes, I do. Mm-hmm.
So you can flip to the next slide. Mm-hmm. And poor you, you're the only person to provide some feedback here. So feel free to give me whatever you've got, and I'll fill the space in, okay? We'll make this as interactive. And so have you faced any difficult decisions? Or you might know a lot of patients, whether it's women with ovarian cancer or patients with other types of cancers that are in support groups sometimes. So it can be from your own personal experience, or you can kind of give me some feedback. And Iris, I'd like to ask you to join in as well, maybe, because I'm sure you've interacted with patients with ovarian cancer or with family and friends. And so this can be about ovarian cancer, or it can be about something else. So what are some tough decisions?
Well, personally, right now I've come to a crossroads. I was diagnosed in July with recurrent ovarian cancer and had 4 treatments, but following an MRI, we're finding that the chemo is not working, so that has been discontinued, and so now that just happened last week, and so I thought this was appropriate because I'm going to be facing, I'm sure the doctor is going to be saying, I think maybe we need to do surgery, or, he's going to be presenting solutions, or, some options to me that we're going to have to decide on what the future is going to be. Some women, a friend of mine here, some women aren't don't even want to have chemotherapy.
Yep.
And so that's a decision that they have to deal with, whether
Absolutely.
it's the initial diagnosis or whether it's a recurrence. This friend of mine just debated for quite some time about whether to have chemotherapy or not, and she has since decided to have it. But that's a difficult decision to make.
Absolutely. Iris, do you have any other tough decisions you're thinking about?
Yes, many women also, when it comes to clinical trials,
Yes.
are not sure what exactly they should be doing, if they should, be part of a clinical trial or not.
Yes, absolutely. Good. You guys have named a few decisions that I had on my list here, and I'll give you a few more of decisions that I know of that patients have talked to me about. So one decision, so a few of them are, what do people tell their children? What do they tell their friends and their colleagues about their illness? It can be, do I pursue genetic testing about my ovarian cancer? Do I start chemotherapy now? So you've named that. Do I start now or later or not at all? Do I sell my home to be closer to the city and to the cancer center? So I've had some patients who said that at the time of recurrence, I'm going to be needing to be on chemotherapy, and so maybe that's something that my husband and I should be thinking about. And certainly they weren't necessarily eye to eye on that, so she was struggling with that decision. Some patients might be talking about advanced directives. So what are the directions in my future care that I want my family to be, how do I want them to make decisions for me if I can't make the decisions, and how do I, start doing that, and how do I have that discussion with my family?
That's a very good one. I'm also dealing with that.
Yeah.
Wanting to do that, but needing to have everybody on board.
Absolutely. So some of this will be useful for you.
Yes.
When do I stop chemotherapy is sometimes a decision that patients are faced, or sometimes patients are thinking about that and speaking to their nurses about that, but they don't know how to bring that up with the doctor. Is also something that we sometimes see in practice, or how do they bring that up with their family member? Another decision might be about where do I want to be cared for when I'm not well, so whether they're on treatment or not on treatment, especially for our women who are living alone perhaps. That might be something that they struggle more with, and even sometimes for our families that do have people with which they live, that can be a struggle. Another struggle that not necessarily involving the patient or the woman herself, but sometimes we have daughters, or it can be granddaughters or sisters who are wondering, my mother had ovarian cancer, and they might or might not have results of genetic testing, but wondering for themselves, should they pursue genetic testing? Should they pursue in the event that they are have a genetic predisposition to ovarian cancer? Should they pursue an intervention to decrease their risk? So should they have their ovaries removed? And what about decreasing their risks of perhaps other cancers as well? So if you switch to the next slide, so my next question is around why are these decisions difficult? So do you think, why, from your perspective, why are those decisions difficult?
Well, I think, I guess because they're life and death decisions.
Yeah.
They could be end-of-life decisions. So it's difficult.
Absolutely, absolutely. I think I'm just going to give other reasons for that. So there's definitely what you've described, right? And we can feel that the emotions involved in making the decision. There's also, sometimes people are struggling, well, what are my choices? Right? So if you're not clear on what the options are, that certainly makes things more difficult. What we also hear around is, well, I'm not sure if my family will agree. I don't know how they feel about this particular issue. Sometimes when we're thinking about place of care, I've heard certainly patients wondering about not wanting to be a burden for their family. And sometimes around being a burden is not so much around the decision, but they don't, also that reluctance of not wanting to discuss certain decisions and things that they're struggling with, just for that piece of not wanting to be an emotional burden, so not to have to put all these heavy things on on the table, right?
Right.
People sometimes are thinking the same things. We see that certainly a lot. So families are struggling and worrying about something, and the patient is doing that as well, but people aren't necessarily talking about what's going on.